Good morning. I'm Dr. Stephen Curtin at Tucson Orthopedics. I'm an orthopedic fellowship trained spine surgeon who's now been in practice for 26 years here in Tucson, Arizona. The goals of these surgeries are to improve your ability to stand and walk pain-free. It's a process. The surgery is just part one of it. The healing and recovery and rehab are the next steps of it. As we go through this journey, at any time, if there's ever a question, call our office, call my assistants. We can help you along the way. And the hope is that in the end, we have an excellent outcome where you're pain-free and walking and standing better. We want you up moving. The surgery, there's a lot of healing that has to happen. We need to focus on good nutrition, good rest, and appropriate exercise. Nutrition is going to be important because with some of the medications we give you, your bowel functions may slow down, and we really want you to stay hydrated, maybe use things like Metamucil or roughage. And then starting a multivitamin with iron is usually considered a good idea to help your body recover from the surgery. It's certainly okay. You're going to be tired. There's a lot of healing going on. Take a nap if you need a nap, but we want you to get some regular exercise every day. We're doing these surgeries so you can stand and walk better, and that's what we want you to do. So after lumbar surgery, there's a lot of muscle dissection, and there's a bit of pain for the first few days. We will send you home with enough medicine that should manage the pain. It won't completely get rid of the pain, but should take the edge off enough that you can be active and do things. We use a technique called multimodal treatment. Different medicines attacking the pain at different places. We will typically have a narcotic, an opioid medicine that will be written for on a certain as needed basis. We may send you home with a muscle relaxant that usually is more on a schedule. And there may be a nerve medication that we give you. The opioids are things such as Percocet, hydrocodone, oxycodone. The muscle relaxants are things like Robaxin, methocarbamol, tizanidine. And the nerve medicine would be something, we use things called Neurontin or Lyrica. Those are medicines we would use. One thing I want to make a point, after your spinal fusion, we want the bone to heal. That's the fusion part. And so we try to stay away from non-steroidal anti-inflammatory medicines. That would be things like Motrin, ibuprofen, Celebrex, naproxen. If you have any questions, certainly we will answer those, your preoperative visit, or certainly post-operatively, you can call and we'll let you know whether you can take the medicine or not. When we put your surgical dressing on, there's two types of dressings we use. One type will be, we leave on for 7 days. That dressing will be covered with a barrier. You can shower on that. You can pat it dry. If it soaks up a little bit of staining blood, that's fine. If it gets fully filled, that's a problem. But generally, again, when you leave the hospital, the dressing you leave with, we will either leave it on for 7 days if it's the silver type dressing, or we'll use a dressing that we'll probably remove before you leave the hospital. And then if that dressing is removed, if there's no drainage or anything, we don't have to keep your wound covered, and you can go home and shower on it. If it does have a little staining for the first few days, we just keep a light dressing on it. We like to protect the wound for about maybe 48 hours. Usually the dressing we put on in the operating room, though, is a barrier dressing. And so theoretically, you could shower immediately. We try to get you up and moving in the hospital, and hopefully on day 2 or 3 after surgery, we'd like you to get a shower. If it's the dressing that's been removed, if the wound is sealed, again, you can shower right on it. We don't want you soaking the wound, but it can get wet and you can pat it dry. One of the things, post-operative concerns we would have is wound problems. So any signs of infection, this would be manifest primarily by increasing pain, any increasing drainage or fever, or just not feeling well. those would be things that we'd want to be notified sooner than later about. The other probably big thing that it sounds self-evident, but falling. You just cannot take a fall after surgery. We don't want you taking a fall ever, but you're going to be sore. You may be on medicines. You have to take extra care to prevent falls. If you're getting up at night to use the restroom, you might need a walking aid or some assistance. So we want people to be very careful not to take a inadvertent tumble or fall and undo or hurt something. The standard things is make sure there's nothing to trip over, shag rugs, anything on the floor. If there's a corridor to your bathroom at night, and if you're getting up in the dark, make sure there aren't things to fall over or bump into. The other thing is some people will find after the lumbar surgery, if your bed is too low or chair's too low, it's hard to get up and out of, and this is something to consider. Things like toilet seat risers, chairs to sit in, and getting in and out of your bed. Most of the medicines that we're prescribing after surgery are to help with your pain and allow you mobility, so you can get up and move and do the things we did the surgery for. Certainly if you have a concern, extreme pain, or you have taken a fall, or you're worried there's an infection, a call to our office during the office hours is the quickest way for us to get hold of you. Obviously, if it's weekend time or after hours, you call our service, again, for emergent things.